ditch this with the most disgusting thing that's happened to you while working.
So when you get admitted into the ICU, we do, a head-to-toe bath. We need to clean you up, do our head-to-toe assessment to see if you have any skin problems, etc. So we're bathing this lady, a rather large lady, may I add, and she had multiple skin folds. So we're like bathing her and she smells rancid. I'm like, ma'am, when's the last time you had a bath? She's like, it's been quite a while. I'm like, yeah, I can tell. Woo. So we lift up a fold to get underneath there. There is a dead frog in her fold. A decaying frog. I'm like, ma'am, you have a decaying frog underneath your skin folds. She's like, oh, that's Bernie. I wondered where he went. She had frogs for pets in her house, and one of them was in her fold and was decaying.
What has someone said to you that will stick with you forever?
So as everyone knows, hospitals are massive and confusing, and it's hard to find your way to get around. And somebody told me this story on my very first day of nursing orientation, and it stuck with me forever. And this young woman was telling a story about how she was at work one day and she was on a break, and she saw a young gentleman who was walking the hallways, and he seemed anxious and confused. And so she asked him, do you need help finding somebody or someplace? And he said, yeah, I'm trying to find the children's wing. And she, instead of just pointing him in that direction, was like, I'm just gonna walk with him there so he doesn't get lost. And so on her way, he told her that his wife had just called and told him that their 4-year-old daughter had cancer and was not doing well. And the moral of her story is that every person that you meet at a hospital might be taking the worst walk of their life, and to not make them take that walk alone. And I love that.
Dude, I had a 5th grader come running towards my office holding his knee, right? He's bleeding from his knee. He's like, oh my god, I fell on the playground, blah, blah, blah. And I was like, well, you wouldn't have fell if you would have tied your shoes, right? Because his shoes were untied. He goes, yeah, that's true. I go, by the way, those shoes are really cool. Where'd you get them? He's like, oh, I got these from my drug dealer. And I'm like, what? He's like, yeah, I got these from my drug dealer. I don't know what he laced them with, but I've been tripping all day. And I had to, I got thrown back, right? I was like, wait, what? Did you just slide in a joke, mid-conversation? How did I? What? I literally fell into that. But, that was so clean. I'm, genuinely impressed, okay?
So, I'm a nurse. I just got home from work. I work 12-hour shifts. I live right here. My neighbors, 2 doors down, right there. They got my groceries delivered to their place by accident. And I got a picture from Amazon, had their doormat, their address, and I politely knocked on the door, had my mask on and everything. I heard them talking. They shut their blinds. I knocked again, and the lights went out. And I heard them laughing. That's really sad. I just moved in here too.
Hilarious encounters I've had with medical students. Or as I like to call them, baby docklings. I once had a medical student try to perform a rectal exam on me, but he kept sticking his finger in the wrong hole over and over and over. When I asked him if he needed assistance or wanted me to call for the nurse, he just took his finger out of my vagina and walked out of the room without saying anything. I once had a medical student refer to my condition as hyper-angry POTS instead of hyperadrenergic POTS in front of his attending. I once had a medical student wheel one of those portable computers to my bedside to Google my condition, and he made me spell it for him. I once had a medical student trip on my urinary catheter tubing and pull it out.
The next time you start complaining about how your nurse is a bitch, we are bitches, because we are so sick and tired of putting up with your asses. While I was still a nursing student at the ER, I was helping out to reanimate a 35-year-old man with a heart attack, and we were busy with him for 2 hours, and the man didn't survive. At the end, I was like, this was just a shocking moment for me, and I decided, this is what I want to do for my life. It's such a shitty job, but it's so important. And then, about 45 minutes later, I was doing something else with some other patient, and this Karen come up to me, screaming, said that I forgot to bring her a glass of water 45 minutes ago. For all of you, nurses are not waiters, and waiters are not your slave. Repeat after me. Nurses are not waiters, and waiters are not slaves.
Okay, my fellow nurses, so I just found out something that blew my mind. You know how we write "will continue to monitor" at the end of our note? Well, apparently a nurse got her nursing license taken because she wrote that at the end of her note. She had done her round, patient was fine, and shortly after, I guess he passed. When she had to go to court because they did some investigating, they found a loophole and said, well, if you're writing "will continue to monitor," were you actually standing there next to that person monitoring them? And of course not. Like, we don't do that. Well, for that reason alone, they took her license and blamed her for the incident, I guess. I don't know. But I didn't know that. Did you?
So I had to get tested for COVID today, and what an experience that was. So the nurse pulls out her swab thing, and you know what? At first, it doesn't look that threatening. It just looks like a long Q-tip. She's like, okay, first I gotta swab your throat. So I open my mouth, expecting her to swab the back of my throat, like it's not gonna be that bad. She fucking yeets the thing all the way down to my stomach. She finally takes it out. I barf in my mouth. Ooh. Swallow that back down to be courteous. Now she has to shove that fucking vomit rod up my nose. So she starts shoving it up my nose, and I'm like half sneezing, half coughing, half having a fucking seizure. She's like, are you okay? Do you want me to stop? And I'm just like, keep going. And she rams it so deep, I'm expecting it to pop out the fucking back of my skull. So she takes it out, and she's like, do you have any questions? Meanwhile, I'm just like, fucking liquid dripping out of every orifice I have. But for real, guys, it sucks, but I guess getting tested is important. So, yeah.
So the story of taking my nursing boards. It's an interactive test, so you can get anywhere from 75 questions to 250 questions, depending on how you're doing, okay? So 75 runs around, and I'm like, this is it. I get ready for the computer to shut off, and I'm like, okay, I passed. I killed it. And then it goes to 76 questions, and 77, and 78, and I'm like 100, 110, and I'm like literally dripping sweat, about to cry, think I failed, like losing my mind inside this test center. I get to 152, okay? 152, and it just shuts off. And I walk out and like literally cry in my car, and 3 weeks go by until I get my results. Thanks, California. And I passed.
Stitch this with the craziest coincidence that is.
In 2015, I was 16 weeks pregnant when my water broke. Unfortunately, that did cause me to go into labor, and I lost my baby. It was both traumatizing and heartbreaking, but the nurse that I had is someone I will never forget. She had porcelain skin and red hair, and she was just so comforting and nurturing and compassionate during a really difficult time in my life. Fast forward to December 2016, and I'm having contractions with my rainbow baby. So I go into labor and delivery, and the two nurses there are like, oh yeah, girl, you're definitely in labor. We're gonna go get you your nurse for the day. Guess who the nurse was for my rainbow baby? The same nurse that I had during my miscarriage. And she goes, oh my gosh, I read your chart before I came in here and I remembered you. And I was like, I remembered you. And all four of us were just in the room crying. It was such a special moment.
So what's the dumbest thing you think you've probably done as a nurse?
I could easily make an entire series off the dumb shit I've said or done as a nurse. But one time I had a patient who came in because they overdosed on Tylenol, and then they told me they had a headache, and I offered them a Tylenol. They said I can't have Tylenol, I just overdosed on it. I was like, alright, yeah, sorry. I'll dim the lights.
Stupid shit I did as a student nurse, part 2. Here we go! I once called an elderly patient mom when I was leaving the room. When I was orienting in the ICU, I tripped on the air going to somebody's BiPAP, which is essentially one step below a breathing tube, and I pulled it out. Assessing lung sounds on a morbidly obese patient, and I couldn't hear anything, and I thought she wasn't breathing, so I called a code blue. I had a patient with dementia who was sundowning tell me that he didn't like me, and I went to the storeroom and cried. So this is a common theme, but when I was watching my first Spinal Tap, I threw up while wearing a mask. Through the mask. I once told a patient to simmer down Negative Nancy when they were talking about dying. They were a terminal cancer patient. On my first rotation, we were at a nursing home and I was washing up this patient who had an enlarged scrotal sac. I got so terrified that I screamed out into the hallway for help.
I really want this degree, but sometimes it feel like this degree don't want me.
Bruh, when I was in nursing school, we had an exam question that said, a woman is in active labor and she's complaining of nausea. Which is the most correct response? A, page the physician. B, give 10 milligrams of ondansetron. C, do nothing. D, give the woman a cracker. All the students picked ondansetron. That's an antiemetic. The name brand is Zofran. You've probably heard of it. But we all picked ondansetron, not anything else, because it's an antiemetic, right? No, we all missed it. The correct answer was cracker. Give a woman in active labor pushing out a baby a cracker. We all fought that question with the Dean of Nursing. We eventually won, but the most correct answer, most correct task is to give an active labor patient a cracker.
A patient of mine who had been intubated for a while took his first drink today, and it was apple juice. And then he sat back and looked at me and in a hoarse voice asked, "Why is it spicy?" And I about fell out laughing.
One of the funny things about travel nursing is that you forget that people don't know you. You forget that you no longer work in a hospital where people have known you for years. Anyway, so today, this nurse was like everybody's mom. She's so cute. She comes up to me and she pokes me at the waist, and I don't react. And she goes, "Oh, you're not ticklish?" And I dead ass turn around and I go, "No, I'm dead inside." And she just looks at me and she's just like...
The weirdest case I ever saw was at Harvard. A young girl came in for a resection of a brain tumor. It's in the back of her head in the cerebellum. And she was around 12. It's been many years. But she had her surgery. The surgeon said that the tumor turned out to be a teratoma, which is a primitive tumor. Basically, it's a baby, a tumor that's made out of a baby. And it isn't a formed baby, but there's all the components of a human in it. There's hair and skin and fat and teeth and bone. This baby was red-haired. The teratoma usually occurs in the ovaries, but this one occurred in the brain, the only one I've ever seen in the brain. Again, extremely rare. And the patient was cured, did fine, but just very strange. Little pieces of bone sticking out and teeth and fat and so forth. So that is a teratoma.